So much, Grace. So, hello, my name is Rutafina Donko, and as stated in the introduction, and Grace, I'm the country director for VillageReach in Mozambique, where we have co-developed, scaled, and integrated several innovative programs to the government. While many programs can show great progress and impact, we have found that so many programs end when donor funding ends. At VillageReach, we have tried to change that trajectory by developing a systematic approach to sustainability, which we call transitioning well, that starts not in the middle or the end of a program life cycle, but in the inception phase. My colleague Lucky and I will take you through both our approach and some case studies. Through the presentation, we will share our key lessons learned and provide some recommended action points that you can consider as part of your own transition journey. Next slide, please, Grace. Okay, so to find sustainability approach that works for you and the government and people you work with, you need to determine your target end state. Who will oversee, manage, operate, and finance the innovation? What level of coverage should the innovation reach? And what does good performance look like? In this presentation, we talk about different approaches. We've taken to move from phase 1 to 4 on this continuum. Number 1 being where something is co-developed with government, but your organization is the one that manages and operates it to the point where the government is the manager and operates on its own and only requires external quality assurance checks or advice. So what tools exist that can help you get from one stage to the next? Next slide, please, Grace. So there's many different scaling and sustaining through government tools that exist, and each has different levels of details and tools. Some of the known ones are ExpandNet, the Mountain Model, Scaling Up, and VillageReach's Transitioning Well guideline and tools. Transitioning Well is the approach that VillageReach has taken. You will see how we have applied it shortly as we present some case studies. Next, please. In VillageReach's scaling and sustainability approach, we co-design with governments and communities from the onset. The items on this slide that are underlined are both milestones and guidelines that exist for achieving the milestones. After co-developing and implementing a program and its solution with the government, we then do outcome or impact evaluations and cost the solution. If the solution is effective and affordable, and the government has continued to buy in, we work on scaling and planning for transition or integration into the government systems. Then, after transitioning to the government in a phased approach, we monitor progress post-transition and provide strategic advice on the evolution of the solution as technology and management practices will also continue to evolve. So continue, Grace, so that at least the whole slide will be, thank you. So we can continue to the next slide. Okay, thank you. So since 2019, we have applied this approach across 13 of our programs and have been sharing our learnings both internally and externally to support others in their scaling journey. We have also developed guidelines and other tools that capture our learnings and ensure a systematic approach to application inside VillageReach. Our many applications have been very challenging, but we have learned a lot. You can continue to the next slide, please. So what have we learned? So what have we learned? We've learned that it is important to recognize that not everything can be transitioned. For example, one of research projects or campaigns won't be sustained. Solutions that aren't impactful or aren't affordable shouldn't be transitioned and sustained. So it is important to really ask what government will ask and be honest. Is it impactful? Is it affordable? And the second thing is to note is transition and sustainability is extremely difficult, even when applying transitioning well. It can be a long journey and one that is not linear, requiring many prerequisites like financing, legal and regulatory frameworks. With changes in government leaderships or priorities, you may have to revise your approach multiple times. However, proactive approaches like transitioning well don't guarantee success, but without them, failure is almost a certainty. Governments say, don't come to us, and at the end, we want to do it together. If you have multiple champions, even as your innovation program or solution changes, it will be more likely to withstand time. Changes in government, changes in strategies and policies, and all other changes that may come your way. Our approach and tools are robust and applicable and are fundamental to our sustainability approach and are built on the foundation that you must be deliberate on every stage about how it will be sustainable. Even after transition, VillageReach and other organizations that transition should maintain an advisory role. We pride ourselves in the programs we have transitioned. However, we have learned that you should remain a trusted advisor to the government as innovations or programs need to evolve with evolving technologies. So sometimes helping governments identify some new adaptations or areas of improvement can go a long way to ensure the solutions continues to be impactful. There are so many learnings, but we want to get on how we learn this. So first, my colleague Lucky will take you through our health center by phone journey from Malawi. So next slide, and over to you, Lucky.
Thank you, Rodafina. As Rodafina noted, I am Lucky Gondre. I had the amazing opportunity to be seconded to the Ministry of Health in Malawi when we were transitioning to Badajabafoni, or Health Center by Phone, also known as CCPF, to the government. Health Center by Phone is a telehealth solution that includes a hotline and a messaging service. So the idea for it came from the community through a Share an Idea, Save a Life campaign in 2009. After being co-developed with the government, it was piloted from 2011 to 2013 as a maternal, newborn, and child health hotline. And it was during this pilot that it was proven to be impactful. At that point, we began to scale the solution to more districts because it was effective and the government wanted it. We continued to scale it until it got to it being nationwide, and expanded it as well to all health topics. Now, within that time frame, we managed to develop an MOU with Airtel, which is the leading mobile network operator in Malawi. And we work with them for them to zero rate the calls, which means that the calls would be free for users but also post-transition, the service itself would be free for the government as well. During the same time frame in 2017, we also signed an MOU with the government, essentially strengthening the decision they made to embed the solution within their strategies, embed it within their budgets, and then also integrate it into the normal way of working. So we moved the hotline from the districts because it was piloted in one district in the beginning. So throughout the transition process, we moved the hotline to the capital city, scaled it fully, so it was available nationwide, and then prepared it for the transition over to the government. Now, getting each of these steps built in took time. And then it also took myself and my colleague being positioned or embedded within the Ministry of Health and working with champions within the government at multiple levels to try to figure out what were the best avenues for the solution to be embedded within the system. So after the solution was, after it was integrated within the government strategies at the time, as well as their budgets. It was officially transitioned to the Ministry of Health in 2020. The government now fully owns it. They steward it. They're staffing it as well. They also pay for all the maintenance that's done for the technology as well. During the COVID-19 pandemic, the solution was quickly adapted by the government for case detection and to share accurate information to the public as well. It continues to be used to provide information on all health topics, as well as being used during different types of emergencies. After a year following the transition, we as VillageReach also worked with the government to implement an external evaluation of the transition, and we called the transition a success. However, in recent years, the government saw that the quality of the service and use of the service started to go down. There were other issues like looking at how the technology also needed to be updated as well. So we worked with the government and then calling into that post-transition support that has been mentioned earlier. We worked with the government to develop a 5-year strategy on how they wanted to improve it and evolve it, and how they were thinking about integrating emergency services to the solution as well. Even though we transitioned the solution, again, going back to that conversation around post-transition support, we found that sometimes there's a need to help the government understand the solutions cannot be static. They need to move, they need to improve, they need to evolve with time as well so that they continue to remain relevant, especially within the scope of the changes in the public health or global health landscape, which is the area that we work in. But then also, if the solution is technology-based, looking at things like emerging technologies, things like AI, of the sort. So our learning has helped our other teams in their transition and integration approaches as well. So I will now hand you back over to Rotafina to take us through our last mile supply chain work that is now in its final stages. Thank you.
Okay, thank you so much, Lucky. So we will not go into a full case study for the outsourced transport solution, which became part of the last mile supply chain, rather how we have evolved our approach based on lessons learned. So one approach was to move to a phased approach. While the project started in 2015, in 2018 and 2020, fourth-party logistics team was brought in and once scaled to all 11 provinces of Mozambique, and having scaled nationwide, why do we move in technical assistance role? This has allowed us to continue to build skills with the government and help them adapt. So we can move to the next slide, please. So we will talk we'll talk about based on our lessons learned. We have several recommended actions for you. And the first one being, from the beginning, do co-develop, do co-development, collaboration, scaling, and sustainability discussions with the government. If you aren't doing this yet, please start it now. Know the impact and the cost of your solution and determine what is needed to continue to deliver quality services before investing in scaling and transition. Another thing you might take note is develop transition management skills at multiple levels in your organization and in the government, as well as strong government champions. Again, build quality management in your approach with robust standard operating procedures and collaboration agreements. CCPF and last mile supply chain have been able to withstand government changes and shifting priorities due to formally documented MOUs and toolkits. Another important thing is every innovation will need upgrading and adjusting. So understand what your role might be post-transition. Help governments build that into post-adoption plans. So, so if you are interested, please, we can go to the next. So if you're interested, please, in learning more or would like advisory support on your programs, feel free to reach to our sustainability lead, innovation lead, or any of our coaches. So thank you so much. We will now open for questions.